Hello, dear viewers. I'll be taking you through a brief introduction to superficial mycosis. And you need to know that superficial mycosis are fungal infections of the outer layer of the skin, your hair, and your nails. And what are the predisposing factors to superficial mycosis? First, a predisposing factor is a condition, it is a trait, it is a habit that increases an individual vulnerability, susceptibility to a particular disease. And what are the predisposing factors? These predisposing factors include high temperature. When you go to an environment that has a high temperature, where there's an increase in temperature, you have an increased risk of getting a fungal infection. We talk about high humidity. When you go to an area where there's high humidity, like humidity, it is the amount of water vapor present in the atmosphere. So when there's high humidity, you have an increased risk of getting a fungal infection. Next, we talk about greasy skin. If your skin is greasy, if your body is greasy, you have a high risk of getting a fungal infection. The use of corticosteroids. And what are corticosteroids? Corticosteroids are anti-inflammatory drugs that mimic cortisol, a natural hormone produced by the adrenal gland. We talk about immunodeficiency. If you are immunodeficient, you have a high risk of getting a fungal infection. Among these factors, if you have one of the factors, then